Please subscribe our channel. Press bell icon to get continuous updates. British Homeopathic Pharmacopia was published in which year? Option A 1970, Option B 1870, Option C 1865, Option D 1960. Answer option B 1870. Repertory of diarrhea was written by option A Bell, option B Clark, option C Gunsey, and option D Bonnie Hassan. Answer option A Bell. First released immunoglobulin after primary immunization. Option A immunoglobulin E, option B immunoglobulin G, option C immunoglobulin M, option D immunoglobulin A. Answer option C immunoglobulin M. Noguchi's medium is used for option A Bordetella, option B Borrelia, option C Brucella, option D Salmonella. Answer option B Borrelia. Main nerve supply of palatine tonsils. Option A lesser palatine nerve, option B greater palatine nerve, option C glossopharyngeal nerve, option D facial nerve. Answer option C glossopharyngeal nerve. Trachea bifurcates at the level of option A fifth intercostal space, option B sixth thoracic vertebrae, option C sternal angle, and option D T10. Answer option C sternal angle. One of the following is non-essential amino acid. Option A triosine, option B cysteine, option C valine, option D methionine. Answer option A triosine. Immunoglobulin which crosses placenta is option A immunoglobulin G, option B immunoglobulin M, option C immunoglobulin E, and option D immunoglobulin A. Answer option A immunoglobulin G. Most common organism causing osteomyelitis in drug abusers. Option A Staphylococcus aureus, option B E. coli, option C Klebsiella, and option D Pseudomonas. Answer option A Staphylococcus aureus. One of the following does not contribute to peripheral resistance. Option A heart rate, option B blood viscosity, option C diameter of blood vessel, option D length of blood vessels. Answer option A heart rate. Not belong to the class of chronic disease. Option A one-sided disease, option B indisposition, option C mental disease, option D intermittent disease. Answer option B indisposition. Ill humor during wet stormy weather. Option A ammonium mure, option B ammonium car, option C natrum sulf, and option D all of the above. Answer option B ammonium carb. Was first used as a tobacco antidote. Option A tabacum, option B coca, option C spigelia, option D thuja. Answer option B coca. Attachment of trapezius except option A first rib, option B clavicle, option C scapula, option D occiput. Answer option A first rib. Joint not commonly involved in patients of rheumatoid arthritis. Option A. Metacarpophalangeal joint. Option B. Proximal interphalangeal joint. Option C. Wrist joint. Option D. Distal interphalangeal joint. Answer option D. Distal interphalangeal joint. Not a cause of hypertriglyceridemia. Option A. Diabetes mellitus. Option B. Obesity. Option C. Smoking. Option D. Alcohol. Answer option C. Smoking. Secondary amyloid occurs in all except option A. Medullary CA thyroid. Option B. Chronic tuberculosis. Option C. Acute osteomyelitis. Option D. Cirrhosis. Answer option C. Acute osteomyelitis. Prover of Ambra. Option A. Herring. Option B. Hanman. Option C. Swan. Option D. Rubini. Answer option B. Dr. Samuel Hahnemann. Painful soreness of eyeballs. Option A. Euphrasia. Option B. Allium cepa. Option C. Eupatorium. Option D. Symphytum. Answer option C. Eupatorium. Hemorrhoids protrude every time he urinates. Option A. Aloes. Option B. Baryta curve. Option C. Sulfur. Option D. All of the above. Answer option B. Baryta curve. Whooping cough. Causative organism is Bordetella pertussis. It is a gram-negative cocobacilli. Strict aerobes. Culture medium gives thumbprint appearance and aluminum paint appearance. Types mainly Bordetella pertussis, parapertussis and bronchoseptica. Whooping cough. It is also known as pertussis and 100-day cough. Whooping cough is a bacterial infection of the lungs which is caused by a bacterium Bordetella pertussis. The coughing may be so severe that it leads to vomiting and aspiration. Age. Commonly, it affects below 5 years of age. Sex. Females. Incubation period 7 to 14 days. Spread mainly through droplet infection and direct contact. This is a picture showing the mechanism of infection. Stages. Mainly 3 stages: catarrhal stage, paroxysmal stage and convalescent stage. First, catarrhal stage. It is the most infective stage. Symptoms are coryza, lacrimation, cough, fever, malaise. After 1 to 2 weeks, it becomes paroxysmal stage. Paroxysmal stage. In this stage, the cough becomes spasmodic, repetitive and explosive cough. Then convalescent stage. After 2 to 4 weeks, cough becomes less frequent. Complications: subconjunctival hemorrhage, epistaxis, hemoptysis, inguinal hernia, bronchitis, urinary incontinence, rib fracture, convulsion, coma. Lab investigation: direct fluorescent antibody test, culture method. Contraindications of DPT vaccine. History of epilepsy, convulsion, CNS diseases. Stool, yellow substance like pulp of orange in discharge. Option A, lobelia. Option B, natrum carb. Option C, natrum self. Option D, none of these. Answer option B, natrum carb. Urine, odor of musk. Option A, nitric acidum. Option B, ocimum canum. Option C, lobelia. Option D, terebinthine. Answer option B, ocimum canum. Letters appear red. Option A, ruta. Option B, phosphorus. Option C, sulfur. Option D, physostigma. Answer option B, phosphorus. Fluttering of heart felt in throat. Option A, calcarea ars. Option B, physostigma. Option C, cactus. Option D, baryta carb. Answer option B, physostigma. Pain at a spot above the third left costal cartilage where it joins the rib. Option A, pix liquida. Option B, Paris quadrifolia. Option C, ruta. Option D, none of these. Answer option A, pix liquida. Toothache, better while eating. Option A, spigelia. Option B, creosotum. Option C, plantago. Option D, coffea. Answer option C, plantago. Pain over McBurney's point. Option A, echinacea. Option B, radium bromatum. Option C, both A and B. Option D, none of these. Answer option B, radium bromatum. Tendency to eat far beyond the capacity for digestion. Option A, calcarea carb. Option B, Apis canadensis. Option C, Apis nigra. Option D, none of these. Answer option B, Apis canadensis. Railway spine. Option A, Actia spicata. Option B, Bellis perennis. Option C, Arnica. Option D, Ruta. Answer option B, Bellis perennis. Varicose vein on nose. Option A, Hamamelis. Option B, Carbovec. Option C, Naja. Option D, Echinacea. Answer option B, Carbovec. Egg produce diarrhea. Option A, natrum carb. Option B, Chininum arsenicosum. Option C, Chininum sulfuricum. Option D, calcarea carb. Answer option B, Chininum arsenicosum. Sphere of action of Ceonanthus americanus. Option A, kidney. Option B, spleen. Option C, duodenum. Option D, blood vessels. Answer option B, spleen. Cold sensation in the teeth and mouth. Option A, cocculus. Option B, cophia. Option C, coccinella. Option D, all of the above. Answer option C, coccinella. Family of Cophia cruda. Option A, cruciferae. Option B, rubiaceae. Option C, anacardiaceae. and option D amblyophilaceae. Answer option B rubiaceae. Intense itching without eruptions. Option A dolichos, option B cicuta, option C both, and option D none of these. Answer option A dolichos. Amenorrhea with ophthalmia. Option A pulsatilla, option B ferromet, option C euphrasia, option D tuberculinum. Answer option C euphrasia. Inimical of Syngum metallicum. Option A nux vomica, option B chamomilla, option C both, and option D none of these. Answer option C both nux vomica and chamomilla. Pulse abnormally rapid out of proportion to the temperature. Option A veratrum viridae, option B digitalis, option C pyrogenium, option D cactus. Answer option C pyrogenium. Sensorium becomes cloudy. Great apprehension at night. Cannot remain in bed. Option A opium, option B rustox, option C gelsemium, option D lycopodium. Answer option B rustox. Child refers to the navel as the most painful part. Option A abrotanum, option B spigelia, option C plumber met, and option D lachesis. Answer option B spigelia. Please subscribe our channel. Press bell icon to get continuous updates. Thank